Would you like to solve your revenue leakage? Well, there's a way to do it through optimizing payer-provider data. Sharing data has become and will continue to be the center of healthcare. Now, there's a missed opportunity to save $16.3 billion by improving the way payers and providers share data. If you're shifting from a fee-for-service to value-based care model, you know that you need to put top-quality healthcare first, with teams working together more collaboratively than ever before. It's quality over quantity every time. But here's the thing. To really nail value-based care, we have to be unified in how we handle all that clinical and provider data. So why does that matter so much? Well, think of every mistake, every error within your provider data as a dollar burned, wasted revenue. As an organization, do you have any grasp on how many errors lie hidden within your clinician data? Establishing a unified approach and shared data sources can streamline processes like claims processing, credentialing, and enrollment, promoting the accuracy and partnership you're looking for. This kind of data integration cuts wasteful spending practices and potentially saves lives. Ultimately, improving data sharing between our healthcare organizations is vital for advancing high-quality, disruption-free healthcare. To learn how Madaket can clean up your provider data and identify revenue leakage in your organization, go to madakethealth.com.